Hi everyone, this is Professor Williamson. This is a audio to help you as you move through the assignment here in lesson 9. It's important to note that this particular assignment, as noted here on the document, is focused on the nervous system, the sense organs, and respiratory system, and that relates then to chapters 8, 9, and 10, which were touched on in depth in previous lessons. Specific lesson 7 and 8 of this class. So in lesson 7 and 8 of this class, you had a quiz, but you didn't have a coding assignment. So this assignment is focused on coding for those particular chapters and body areas and body systems. It's important that you are looking at, especially for the case studies as noted on this assignment, that you are looking at the full text in the textbook. All of these exercises are in your textbook. Some of them are in the area of procedure coding statements or procedure statement coding, and some are cases. You are going to be asked when you move to the submission area, you are going to be asked to provide the root operation, which is a term, and you will be asked to provide the ICD-10 PCS code or codes that you would assign. There's no email submission, and again, I suggest that you work on this assignment offline and that you double check your codes before you move to the submission window. Make sure your Z's are Z's and not 2's. Make sure your 5's are not 2's. If they're, make sure your 2's and your Z's and all those things are correct. Also, when you are typing in the submission window, your alphabetic characters should be in uppercase, and there are no decimal points, as you know, in an ICD-10 PCS code. If you feel that you're getting very stuck as you're moving through the process of coding these statements, if this presentation doesn't help you, please email me in Canvas so that I can facilitate, point you in the right direction, so to speak. I will not confirm if you say, well, Professor, I think I want to assign this code. Is this correct? I'm not going to confirm or deny if your codes are correct, because that's what the submission is for. But if you're feeling stuck on the anatomy, or you're feeling stuck on kind of which way to go in terms of the surgical approach, I can give you some direction, but I will not give you the correct code, nor will I confirm that your code, if you submit that to me via email, is correct. You are submitting your answers here in the course, in the section noted in the course. So again, this is chapter focused on assignment lesson 9, but the first chapter we're looking at is chapter 8. Again, we're looking at procedure coding statement. So that happens to be right after the section that has the 3 multiple choice questions. You're looking at the first, number 6. The full documentation in the textbook is also replicated here on the assignment document. It states in your textbook, radiofrequently destruction. What does that word destruction mean? Of left trigeminal nerve, percutaneous approach to treat trigeminal neuralgia. So you're told the surgical approach, you're given some information, and you need to then extrapolate what is the root operation, what is the surgical approach, and then when you move to the submission area, you're going to be asked to type in the root operation term and then the final code. The next one is number 8 in that same section. I'm sorry, number 10 in that same section of chapter 8. The terminology reads fasciotomy with median nerve release. What does all this mean? The use of the term fasciotomy and the medical term of otomy equates to an open surgical approach. And what is the root operation? What is the intention or the objective of this procedure? The next one is also in chapter 8, but it's in the case study section, which is the ones that look like and are formatted more like a operative report. Number 8, the pre and post-op diagnosis is noted in your textbook as rule out meningitis. This patient is having what is called a lumbar puncture or an LP to determine if he or she has meningitis. That fact, why is this procedure being done? The intention, the objective has an impact. They are looking for some information. In a lumbar puncture, the physician makes a small incision or a puncture with a needle into the space between the L3 and L4 of the patient's spinal canal to get out spinal fluid. And it states for you in the clinical documentation that significant sample was obtained of clear CSF, which is cerebral spinal fluid, sent to lab for evaluation. So you need to think about all of that in terms of what is the intention of the procedure, how does that play into your code assignment, it impacts your final character value, why was this being done is the objective, and then what was being done. The physician is inserting a 20 gauge needle, a small needle, into the space between the L3 and L4 of this patient's spinal canal to get out spinal fluid. The next chapter is chapter 9. Again, you're looking at the exercises in the check your understanding section right after the multiple choice and fill in the blank ones. The first one you're looking at is number 4. It's noted in your clinical information. It says repair of laceration of the left conjunctiva. Don't make it harder than it is. Surgical approach, the root operation is right there. And then you need to have the code, obviously. Think about your anatomy. Where is the conjunctiva located at in terms of your surgical approach? The next one is number 6. States in your clinical information in your textbook says sinus endoscopy with repair of cerebral spinal fluid leak of right ethmoid sinus wall. So the surgical approach was an endoscope was placed in the patient's nose. What was the intention of the procedure? The intention of the procedure was to repair a leak of the right ethmoid sinus wall. And this factor of using this endoscope is your surgical approach. So that impacts your code assignment, obviously, your character value selection. And again, when you come to the course submission area, you're going to be asked for the root operation, which is the intention or objective, and the ICD-10 PCS code. The next one in chapter 9 is in the case study section. It's number 4. The pre-op diagnosis is left maxillary pulpeus, and then the post-operative diagnosis is left maxillary mucus retention cyst. The operation is noted in your textbook as removal of contents of the left maxillary sinus. Again, make sure you're reading the entire operative report, which is really one paragraph. This patient is having this procedure done via endoscopy. It states in the operative report a 30-degree scope was then used to visualize the contents of the left maxillary sinus, which was photo documented. I also provided you a picture of a cyst. A cyst is not solid matter. A cyst is a sac, which typically contains some type of fluid or some type of mucousy-like material, and mucus is a type of fluid. In your clinical documentation, the contents were removed. It appeared mainly to contain mucus with a minimal polypoid soft tissue. It is still not solid, so extirpation is off the table. The cyst is not a solid piece of matter or a solid piece of tissue. It's not a piece of metal. It's not a solid piece of tissue like a blood sac or a hematoma. It is a cyst, which is a sac, which in this case has mucus and some small amount of soft tissue. Soft still means malleable, means it's not hard. The specimens were sent to pathology for analysis. The patient has both the cyst and its contents removed per the clinical information. The physician didn't just take out the contents, he actually removed the sac itself. So what does that equate to? He, the physician, is taking away a piece of this patient's maxillary sinus area. This patient has this little sac hanging out, and the physician is taking off this whole entire thing. Very similar, he's not taking out the entire maxillary sinus, he's taking out a portion, similar to like when we remove a polyp, which is also not a solid matter, of a patient's colon. The same idea, just a different place in anatomy. And we are going to presume, since the contents were sent for analysis, that we are going to presume or go with that, because he used that word analysis, that this is diagnostic in nature. This procedure is diagnostic in nature. Then your last exercise is in Chapter 10. Chapter 10 is focused on respiratory. The exercise is in the case study section of Chapter 10. It's number 6. The patient's coming in for a endoscopy or a bronchoscopy. They used a fiber optic bronchoscope, which went through the oral cavity or the mouth. They noted that the patient has what they termed in the clinical operative report in your textbook as creamy secretions in the right lower lobe bronchus and the left lower lobe bronchus, which were drained and suctioned into a canister for cytology, AFB, fungal gram stains, culture, etc. So that is definitely diagnostic in nature. They're taking those secretions and they're going to see what comes back from the laboratory. The indication at the top of the operative note says rule out valley fever and pneumonia. So you do have two clinical locations where these secretions are coming from. You have the right lower lobe bronchus and the left lower lobe bronchus. Bronchus is not the lung. Different piece of anatomy is in the respiratory system, but make sure you're choosing the right body part value. But first you have to decide what is the root operation. So what is the intention? They go in, they look around, they look at the trachea, they look at the vocal cords, then they arrive at the bronchus and they take out these creamy secretions. They are not solid in nature. So again, that's your assignment. It is in lesson 9. There's no circulatory specifically, which is really the other focus of lesson 9. But this assignment is focused on nervous system, sense, organs, and respiratory. If you get stuck, again, you need some direction, please send me an inbox communication if it's somewhat generic, your question. You definitely could post it to the board, but don't post an answer. Say, well, I'm thinking of coding XYZ, here's my code, is this the right code? That's not the best use of the discussion board. But if you're thinking, okay, I read this and, the last one, I'm not sure is lung the same thing as bronchus, which I just did answer for you, but that's the kind of question you could post to the board in terms of the anatomy component. But if you have any questions, please let me know.